guys, good morning. Maddie and I are going to be chatting a little more about feline preventative care, and I'm going to go ahead and ask Maddie. Maddie, what do you think some frequently asked questions that owners might have?
Okay, so first one, Dr. Denney, what does cat preventative care mean?
So preventative care is exactly as it is with humans. It's going and getting your cat's annual exam every year, if not twice a year when they're older. It's managing conditions that they may already have. It's paying attention to changes in your cat's behavior. There's a lot that goes into preventative care, but the biggest is the goal is to prevent disease or to catch disease in the early enough stages where it's more manageable and or treatable / curable.
What is included during a cat preventative care appointment?
So we kind of call this our annual exams, which is similar for people. And we have to remember that our animals age so much faster than we do. You know, I have appointments where, maybe we had lab work done 6 months ago that was nice and normal, but now we're coming in for like a sick visit. And I get this question, but Dr. Denney, we just did lab work. And I'm going to go back and say, okay, I'm going to look. And if it's not been within the last few weeks, my response is going to be so much can change. They age so much faster than we can. And the best part about preventative care is having those baseline blood panels once a year, especially if they're normal, is we have a baseline. We now know what your cat's normals are, what their baseline levels of health are. That way, if there is a change, even if it's subtle, we're gonna pick up on it. And imagine being able to catch a disease before your cat is now symptomatic. That's going to mean the difference between aggressive medical management, which can get expensive, versus possibly just outpatient care where we don't have to spend as much money. Especially in this economy, money matters. It doesn't just grow on trees, and I try to be very cognizant of that. So preventative medicine is just so very important because it catches these things.
Is cat preventative care optional?
So of course it's optional. Kind of like when I go to the doctor and they ask me, do we want to do lab screening? My answer is always yes, because I know things can change. In fact, just last week, I have an elevated liver enzyme. It's mild, but it's there. So I know that I have to keep an eye on it. It's always optional, but when we talk about these things, it's strongly recommended because preventative medicine is going to help your cat live to be happier, healthier for longer. And it's also going to afford me the chance of seeing them every year, of going through and checking their organ function, of catching problems before they start.
Do I need to consider flea and tick prevention for my cat, especially if it's indoor only?
So this is a bit of a misnomer, and I would say here where we live in Texas, fleas can come inside on us, especially if we're outdoors, especially if you have another animal that's going in and out. Like if you have dogs that are going in and outside just to potty, your cat needs to be on flea prevention. We also live in Texas, which means we have heartworm disease, which is transmitted by mosquitoes. Mosquitoes come inside. I don't know about y'all, but I definitely get bit when they're in the house. I am the first thing that mosquitoes go to. I have sweet blood. My husband never gets bit. I always do, and I will be in the house. And if they're biting me, you better believe they're gonna bite your cat. Now, the hardest part about heartworm disease in cats is they are not the ideal host. So even though there aren't gonna be a ton of worms in the cat's heart, the problem comes that we can't treat it. Once the cat has heartworms, we have heartworms. And a good percentage of cats, when that worm dies, the cat will have a massive anaphylactic reaction and will pass away. So yes, I 100% think heartworm, flea, and tick prevention is important, even for indoor animals.
What type of preventative care for my cat can I do at home?
So pay attention to what your cat's normals are. I think that's great. Are we drinking more than normal? And sometimes this is hard to watch because cats don't drink a ton of water, but how we can manage it or pay attention to that is the urine clumps in the litter box. If you know that your cat's litter clumps, like pee clumps, are like this big, and then all of a sudden you're scooping the box and maybe it's double, that's a change. That's something that you can pick up on and say, hey, I need to make an appointment. This is not normal. Or potentially for arthritis, or if something hurts. Cats are really, really good at hiding their diseases. So if you start noticing that your cat is limping or not playing as much or sleeping more than normal Or maybe instead of jumping straight up on the cat tree, they're taking steps to get up to the top and steps to get down. Or where they used to run up your steps fluidly, now they're kind of taking their time. Or when they're coming down the steps in your house, if they're taking time and they're like kind of bunny hopping down. These are signs that of actual pain. So those are things you can watch out for. Looking at your cat's teeth, smelling their breath. You're gonna know what your cat's breath smells like. I have 4 cats. I know what everyone's breath smells like. I mean, my cats, most of them give me kitty kisses, but I'm all over them. Like, I'm petting them, they sleep with me. I feel all over them. You know, I found a bump or a little growth on one of my cats, you know, about 6 to 8 months ago. It was a little tumor, so that had to come off. But these are the sites of preventative care that you can do at home. You're gonna find things because you're seeing your cat every single day. I'm seeing your cat once a year. By the fact that you're seeing them all the time, you are gonna pick up on things. And what I would tell you is listen to your gut. If something is not normal, call and make an appointment. You are going to be the best advocate for your cat because you are the best person that knows them 100%. You're the one that knows all their different meows. You're the one that knows their behaviors and their patterns. You're gonna know when something's different. Are they hiding under the bed? Are they sleeping in the closet? Are they not greeting you when you come home? Are they not chirping at you for their food at the regular time? Because I don't know about you, but my cats are like an alarm clock. If that food is not in their bowl by 6:40, I have the munch, he's my baby, he's like chirping in my ear. And if that doesn't work, I get a tap, 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 tap. So that's a pattern. And I know the few times that he's not done that, something's up. So you are going to be the best person to help with preventative care at home because you are going to pick up on those tiny little nuances that I'm not going to see because I'm only seeing them once a year. All right, thanks guys for joining me. If you have any other questions, feel free to give the clinic a call. Thank you.